You seem to have more of a business approach to this problem. You're using the carrot instead of the stick to get the doctors to take on a bigger workload. Is that a good analysis of your philosophy behind this bill? Because people thought you would use perhaps fines or impose quotas on the doctors, and you're not going that far.
Well, I think I'm using a management approach. And the management, if you want to manage something, you need the data. You need the information on what you're managing. And unfortunately, on a local basis, I think the health system have been managed blindly for many years without the information that is necessary for good management. So instead of taking a punitive approach, I'm taking a management approach.
But there's no guarantee. Other options have been attempted in the past.
Yep.
There's no guarantee this is going to solve the problem, and we still have 800,000 people waiting.
Well, but what's interesting is that I think if you look closely at the way this is designed, there's two ways, and I think that's the reason I'm interested to have the call this afternoon with FMOQ. They can wait until February and do nothing, which I doubt. I think they'll take the approach, let's start right now, because they were saying earlier on this year that they're willing to try this new approach. But now they know what is the deadline, that we can have the information, because now it will be legal to share that information with our local management. That's the first thing. Right now, I cannot do that, but I can manage it. So I think this is a very constructive approach, and that's the reason I've said that I'm offering them, what's the expression? La main tendue, how do we say that?
You're extending your hand.
Okay, so that's what I'm doing.
Mr. Dubé, the Federation of GPs has said that, you're not offering more doctors here. You're trying to squeeze water out of a rock from what we already have. The FMOQ wants more doctors. Doctors have said they want more doctors. There's some 400 plus vacancies for residencies at GPs. They want you to incentivize more people to go into that field. How come you're not taking that approach here now?
Well, because we have been trying to discuss that for years, that one side is saying we need more doctors, and the other side was saying you're not working hard enough. I'm just saying, let's prove it. Let's have the data on what we can negotiate a good agreement. And I need that data to understand in certain region. On the island of Montreal, they're telling me they're too busy. They're working on many other things that they do in emergencies, in CLSC. Let's agree on those data, and when we have the data, we'll be able to find the right compromise. If I'm so willing to increase, as we did for les IPS, les infirmières spécialisées, we have said that we are willing to increase the number of EPS. We're willing to increase the way they can be served also at the pharmacy level. So I think we're willing to do a lot of things. And I'm just saying, but we need the data to agree on who's doing what and where, locally and regionally.
And I know, you speak about this reservation or this booking system as though it's like your travel booking. Where's the best deal? Where's there an open spot? But, one of the things that doesn't address is the patient relationship with a doctor per se. It's one thing to see a doctor a couple times, but patients generally like to have that relationship that lasts years. How did that doesn't seem to address that issue.
And that's the reason I'm saying we're not changing that. We have right now 6.6 million of Quebecers that have an omni, that have a doctor. We don't want to change that. They already have a system of appointment in their private clinic or their GMF. We don't want to change that. We just want to say, I think you can take more for certain doctor. Let's agree on who that should be. And if we don't agree that if we agree that you don't have the time, can we put that on the GMF? Because now you have new tools. you have les IPS, you understand what I'm saying? And by the way, for the next few months, if we don't have enough of those people that can be orphans, okay, they will have access to a 36 hours deadline. And I think that's the way to go. And we've seen that with the vaccination. It worked. We have put, and again, I'll say, the Quebec company that we've used, Click Santé, to do the job has done a fantastic job. Remember, at one point during the summer, we were taking 100,000 appointments per day. This is peanut of what we're trying to do with Rendez-vous Santé. I mean, we've proved that's doable. The technology is there. We want to do it regionally. I think we're ready to go to another step the way we serve patients.